Hello and welcome to our Impact Program webinar. Today's presentation is Information on Skin Cancer Risk and Prevention. I am today's moderator, Jillian Sotelo. During the presentation, we encourage you to use the chat box to engage with other attendees and panelists. Anything written in the chat box will have your name associated with it. All questions should be asked in the Q&A box on the top bar of your screen, which may be submitted anonymously or with your name attached. Questions will be answered at the end of the presentation. As a reminder, we are recording this event to be made available in the next few days on the Impact Program Cancer Care CSC site. Julie Goldstein, one of our Impact Program navigators, will be discussing today's topic with additional information about our program from our Impact Program leader, Kelly Nickelbein. Julie, thank you so much for joining us today.
Thank you, Jillian. Hello, everybody. As I was walking my dog this morning in the cloudless sky, I was thinking this is a perfect day for us to talk about skin cancer risk as well as prevention. So I'm happy you all could join us. Okay, so we have some lofty goals today to cover. First, I want to talk just a little bit about the different types of skin cancer and what risk factors there are for skin cancer. We'll touch on genetic testing for inherited skin cancer syndromes, and then talk more about what we can do to screen for skin cancer and to prevent skin cancer. And then just at the end, to see how well you all were paying attention, we're going to have a quiz. Which will explain how that works when we get there. Excuse me. So, as I said, we're going to start out talking about the different types of skin cancer. Oh my goodness, excuse me. We'll talk about non-melanoma type, then we'll talk about melanoma as well as rare types of skin cancer. So first, I wanted to mention, I am so sorry, I seem to have lost my voice. First, I wanted to mention that we know the skin is the largest organ in our body. So there are over 100 different types of tumors that can grow on the skin. Obviously, we don't have time to discuss all that today, so I'm going to break it down to the ones that we see more commonly. So the two most common types of skin cancers are non-melanoma skin cancers, and those are basal cell carcinomas and squamous cell carcinomas. These are what we call kind of the garden variety types of skin cancers. They usually appear on parts of the body that are exposed to the sun. Fortunately, they're rarely found at advanced stages, and the prognosis is typically excellent for these types of cancers. I wanted to put some pictures up here so you could see what they typically look like. You can see the top two pictures are basal cell carcinomas. You can see they look kind of red and inflamed, almost like a scab that's not healing, and they tend to have kind of like a pearly rim around them. On the bottom, you can see squamous cell carcinomas. Those often appear as rough and scaly, and you can see they almost look like a wart. So next we'll talk about melanoma, which are completely different types of skin cancers. These cancers are less common than basal cell and squamous cell, fortunately, but they are more aggressive. So that means they're more likely than other types of skin cancers to spread to other parts of the body. As opposed to the basal cell and the squamous cell that we just looked at, melanomas tend to arise from moles. They can occur on any part of the body. In men, we most commonly see them on the trunk, the head, and the neck. In women, we most commonly see them on the arms and legs. But interestingly, melanoma can actually be found in other parts of the body, even in the eyes. So not always necessarily in these spots. So since I said that melanoma typically arises from moles, it's pretty important for us to get a sense of how we know what a normal mole is versus what would be concerning for melanoma. So there is this graphic setup called the ABCDEs of detecting melanoma, kind of a catchy way to remember what to look for when you're looking at a mole to think about whether or not it could be concerning. I think this is a great time if you want to take a screenshot or even take a picture of it with your phone to keep this graphic so that you have it in mind, especially if you tend to get moles. Good information to have. So the A stands for asymmetry. So you can see this top picture is what a normal mole should look like. It's symmetrical, meaning if you cut it down the middle or if you cut it top to bottom, all sides would look even and the same. Clearly, that's not what we're seeing on the bottom. Very different from the left side to the right side, as well as from the top and the bottom of the mole. Next, the B stands for border, so the area surrounding the mole. What we want to see is a nice, even border. Again, if you look at the one on the bottom, you're seeing a lot of jagged lines, not a nice, even spread of the outside. The C stands for color. So moles can actually be all different colors within a normal range. What's more concerning is if there's a change in color within a mole. So you can see in the top, this is a brown mole, and it's all one color. It's all a uniform color. On the bottom, you can see it starts out as a dark brown, then there's kind of a black area, then a lighter area. So that's multiple colors within one mole, which can be concerning. The D stands for diameter, so the size of the mole. Most normal moles are smaller than about a quarter of an inch. Some people use kind of like the eraser on a pencil as a marker for how big a mole should be. We're seeing a mole larger than that. That could be a red flag. Last but not least, and I think probably the most important thing to keep in mind is the E, or for evolving. So that's if we're seeing any changes within one mole. It's very important. We'll talk a little later about skin self-exam, but it's important to become familiar with your moles and observe over time if we're seeing any changes in the size, shape, color, the borders. All of that is important to keep in mind. Last but not least, I wanted to touch on two rare types of skin cancers. First is a Merkel cell cancer. These are neuroendocrine cancers of the skin where the cancer cells are in the hair follicles. Here's a picture of what a typical Merkel cell cancer looks like. It appears as kind of a firm, shiny lump, typically, again, in sun-exposed areas, most commonly in the head, neck, arms, and legs. And it's a painless lump. We can also actually see lymphomas, T-cell lymphomas of the skin. These are non-Hodgkin lymphomas. They appear initially as an itchy red rash that can form into a tumor. Two subtypes of these lymphomas are mycosis fungoides and Sézary syndrome. Okay. So now that we know about some of the different types of skin cancers, let's talk a little bit more about what can increase your risk for skin cancer. I can't emphasize this enough. I'm going to say it now, and I'll probably say it throughout the presentation. Anybody is at risk for developing skin cancer, but there are certain factors that can make those risks a little bit higher. So I want to review those with you now. But again, anybody has some risk for developing skin cancer. First is prolonged sun exposure, particularly without wearing sunscreen. So prolonged sun exposure just means being out in the sun a lot. we see, people who golf or who do outside sports, people whose occupations require them to be outside a lot, like construction workers or landscapers. So people who are just out in the sun more than others. Indoor tanning bed use greatly increases. Even just 1 or 2 sessions can increase the risk for skin cancer. A history of a sunburn at any age. So even if you had sunburn as a child, that can increase your risk in adulthood of developing a skin cancer. Certain types of moles, specifically called dysplastic nevi, which are sort of large, irregular shaped moles, can increase your risk for skin cancer. Skin that freckles and burns easily, and fair coloring. So people with pale skin, blonde hair, blue eyes, freckling, all of those increase the risk for developing skin cancer. And also family history. So there are some families that have inherited genetic changes being passed down through the family that increase skin cancer risk. But even in families who don't have that genetic factor, sometimes just having a first-degree relative, like a parent or a sibling with a history of skin cancer, can slightly increase your risk of skin cancer. So I talked a little bit on the previous slide about fair skin and that increasing the risk for breast cancer. So I'm sorry, skin cancer. So I just wanted to talk about different skin types and how what the spectrum is for skin cancer risk based on skin type. I promised you I was going to say it before, so I'm going to say it now again, that anybody is at risk for the development of skin cancer. But we do know that people with very fair, pale white, freckled skin have the highest risk of developing skin cancer. So these are people who almost always get a sunburn and never tan. And you can see the further you go along on the spectrum, the lower the risk of skin cancer becomes. So people with deeply pigmented dark brown to black skin have a lower risk of developing skin cancer. It's important to note, though, that unfortunately, when skin cancer is diagnosed in people further along on the darker pigmentation, it tends to be detected at a later stage. So again, just a good thing to keep in mind, take a look at, figure out where you fit on the spectrum to get a better sense of your own skin cancer risk. And as I did mention, skin cancer can affect anybody of all skin tones. So it is a myth that only people with pale skin can develop skin cancer. Even in people who rarely burn, skin cancer can develop. As I had mentioned before, it is unfortunately even often diagnosed at later stages in people with darker skin tones. So I wanted to show you some pictures here of what the more common skin cancers can look like on a person with a darker skin tone. So at the top, we see the squamous cell carcinoma. At the bottom, we see the basal cell carcinoma. Again, still something to look out for, even with darker skin tone. People with darker skin tones also can develop melanoma. Again, it's more rare, but it can happen. Interestingly, in this group, melanoma actually occurs on areas that get little sun exposure. So the palms of the hands, the soles of the feet, and even in the nail bed. Not sure if any of you are reggae fans, but we all know Bob Marley as probably the most famous example of a person with a darker skin tone who developed a melanoma, and his was on a nail bed similar to the bottom picture. So if you see a stripe like that in your nail bed, that is definitely something to bring to a doctor's attention immediately. Okay. So now that we know sort of what to look for, how do we know what type of screening we should be having? So unlike other cancers, like breast cancer, where mammography is recommended for everybody, or colonoscopy is recommended for everybody for colon cancer screening, we don't have those kinds of recommendations for people at average risk for skin cancer. So there are no guidelines for skin examination by a healthcare professional for people at average risk for skin cancer. People with some of the risk factors that I had talked about on previous slides, including people with inherited gene mutations, should schedule an evaluation with a dermatologist to discuss what screening guidelines make sense for them. So there's really no cookie cutter guidelines here. So if you do have risk factors, meet with a dermatologist to get a sense of what your screening regimen should be. In general, though, again, if you really don't have any of the risk factors for skin cancer, even though there aren't recommendations for you to be screened by a healthcare professional, it is recommended that you do a self-skin exam on a monthly basis. This is another great time to either get your phone out or do a screenshot to take a picture of this. So this is a plan on how you should be doing your self skin exam. So we'll just go through it again. If you can save this so you remember to do it on a monthly basis, I think that's a great idea. So it is recommended to do this in a well-lit room where you have access to a full-length mirror, a hand mirror, and a way to take a picture like your phone or notebook as well to take notes. So obviously we want you to do this with no clothing on. You'll face the mirror and first look at the front, back, and sides of your legs. Then you'll check new spots on your skin, look at your hands, in between your fingers, again, under your fingernails. So for those of you who wear nail polish, it's good every once in a while to take a break from the polish so that you can take a look at your fingernails and toenails. Then we recommend that you sit down and do the same thing with your feet that we said with your hands. Check the soles, check in between your toes, and check your toenails. Next, you want to look at your scalp, which can be kind of hard to do, but there are some creative ways to do it. So if you can use a hand mirror while you're looking in the larger mirror, you can get a good look at your scalp. If you have a lot of hair, it might even be helpful to use a comb or even use a hair dryer to kind of blow the hair out of the way so that you can get a good look at your scalp. Then we also want you to get a good look at your back as well. And next, you move on to your front side, looking at your chest, your stomach, and neck. It's important to raise your arms and look at your sides and under your arm in your armpits. And just remember that arms and shoulders tend to be the most sun exposed areas. So don't forget to look there. And the reason that I said have a picture device or a notebook is so that you can take pictures if you see anything concerning. So if you see anything concerning on a skin self-exam, the next step would be to schedule an appointment with a dermatologist. Sometimes it can take time, as we all know, to get in to a physician's office. So taking pictures is very helpful so the dermatologist can see what it looked like when you first noticed that spot and can get a sense of whether or not anything has grown or looks different from the first time you noticed that spot on your skin. As far as what to look for when you're doing the self-skin exam, a couple just rules of thumb of what would be important for you to make note of and bring to a physician's attention if you're seeing when you do the exam. First, anything new that you hadn't noticed before or anything that's growing, changing, anything that's new or new bump on the skin, definitely important to make note of. A sore that bleeds or doesn't heal after several weeks. We all can get sores on our skins, but if it's something that's persistent and isn't healing, that's a red flag. Any rough or scaly red patches that might crust or bleed, anything that looks like a wart, even if you think it is a wart, again, important to have that looked at by a physician because it could be a squamous cell. Any moles that are new or changing in size, shape, or color. So if we go back to those A, B, C, D, E's of melanoma, keeping track of any of those types of changes are important. And again, same thing, a mole with odd shape, irregular borders, or areas of different colors. Again, that's all going back to those A, B, C, D, E's of melanoma, all things that should be brought to a physician's attention. Okay, so we talked about the risk factors for skin cancer, how you know if you could possibly have a skin cancer. So I wanted to spend some time talking about skin cancer prevention. Fortunately, with skin cancer compared to many other types of cancers, there's a lot you can do to lower your risks of developing skin cancer and a lot you can do to modify um, your risks. So it's always nice to have an action plan that you can take to lower cancer risk. The first thing to do is seek shade. Now, it is a myth that you really only need to worry about being outside when it's a bright, beautiful, sunny day like today in Philadelphia. Really, the sun can get you at any time. Even if it appears to be cloudy, there still is sun. But the most important thing is to remember that the sun rays are even the strongest between 10 a.m. and 2 p.m. So seek shade when you can, but especially during those hours, just be cognizant that the sun's rays are the strongest. When you are outside, especially if you have an occupation that requires you to be outside, or I don't want to pick on the golfers, but I seem to always do that. Wear protective clothing if you're outside golfing or playing tennis or doing anything where you're outside in the sun for a prolonged period of time. You can wear lightweight long sleeve shirts, pants, a wide brim hat. Very important to wear sunglasses as well with UV protection. And these days, they even make great clothing that has UV protection in it that have a label that can tell you what that protection factor is. So look for those kinds of things if you have to be out in the sun for a prolonged amount of time. I cannot say this enough. Use sunscreen. My kids are sick of hearing me say it, but I am very strong proponent of sunscreen use. So you want to apply enough to cover your skin. That's not that's not covered by clothing. I think people forget this, but remember to include the tops of your feet, your neck, your ears, and if you're bald like my husband, definitely the top of your head. And not only do we want you to apply sunscreen, but remember to reapply it. So after every 2 hours, but if you're swimming or if you're sweating or in the ocean, reapply it more than every 2 hours because you want to make sure that you maintain that level of protection. Next, check your surroundings. So be aware of where you are and how that can impact the sun's rays. So if you're near water by a pool or the ocean, if you're near snow or sand, those surfaces actually reflect the damaging rays of the sun back on your skin. I've seen so many times people get pretty nasty sunburns while they're skiing because they're not thinking about it. It's cold outside. It seems like winter. But again, the snow, just like water and sand, can reflect the sun. So always wear sunscreen and try to stay in shade when you're in those kinds of areas. Last but not least, I said this earlier, avoid tanning beds. These days, there's great products on the market to give you that tan look if that's what you want. The self tanning products are great, spray tans. There's no need to be using a tanning bed. We know that tanning bed use, even 1 or 2 times, is associated with a great increase in skin cancer risk. So find alternative ways to get a tan. Okay, we are completely going to change gears now and just talk very briefly about the inherited skin cancer syndromes. So there are certain people who have genetic factors running through the family that greatly increases their risk for the development of skin cancers. Today, I'm just going to focus on 2 of those syndromes. The first is called familial atypical multiple mole melanoma, which is a mouthful, so you can see why we just call it FAM for short. So this is the condition where people can have up to a 92% risk of melanoma by age 80. To put that in perspective, we know in the general population for people with fair skin, the risk of melanoma is about 3%. And for people with darker skin tones, less than 1%. So this is a great increase in the risk of melanoma. People who have FAM or families with this condition, there are certain features that we tend to see. We tend to see multiple people on the same side of the family who have had melanoma, a family member who has had more than one melanoma, melanoma in the family that occurs at younger than usual ages. In the United States, the average age for melanoma diagnosis is 66. So if we're seeing melanoma in the 20s, 30s, 40s, that could be a red flag that there's this FAM going on. If we see family members with the dysplastic nevi, those were the moles that I talked about before. They're kind of large and irregularly shaped moles. Those also go along with this syndrome. If we see a family where there's melanoma as well as pancreatic cancer, that could be a red flag. This condition, FAM, is generally caused by mutations in the CDKN2A gene, as well as CDK4, but there are likely other genes involved as well. The other syndrome I wanted to touch base on quickly is hereditary breast and ovarian cancer syndrome. For any of you who have been on our previous webinar, our breast or ovarian cancer webinars, you certainly have heard of this syndrome before. You're probably wondering, like, Julie, why are you bringing this up today when we're talking about skin cancer? But we do know that people with hereditary breast and ovarian cancer actually do have a higher risk, about a 5% chance of developing melanoma. So it is part of the cancer spectrum that we see in this syndrome. Ways to determine whether or not this might be in somebody's family, features we tend to see in families with hereditary breast and ovarian cancer would be more than one person and more than one generation with breast cancer. When we see breast cancer diagnosed before the age of 50, in these families, we can see ovarian cancer at any age, but ovarian cancer in the same family as breast cancer raises the red flag. So people with bilateral breast cancer, meaning they've had cancer in both breasts, one person who's had more than one cancer in their lifetime, males who have had breast cancer, certain ethnic groups, mainly people of Jewish ancestry from Central or Eastern Europe, aggressive prostate cancer or pancreatic cancer. So all of these combined together in a family can increase or can raise concern that there's a BRCA1 or 2 mutation. So for this condition, as well as FAM, which we talked about previously, genetic counseling and genetic testing for these mutations is available. When I'm done speaking, Kelly Nickelbein, our program director, will talk more about how the IMPACT program can help if you have concerns about your family history. So I'll leave that to her to tell you about how to reach out to us if you have concerns. Okay, it's quiz time. You guys have made it through listening to me talk. So now we're going to have a little fun and see if you were paying attention. And actually, I think my boss's boss might be on this call, so I'm hoping you guys can make me look good, like I did a good job teaching you. So the way it's going to work is I'm going to go through the quiz questions. Jillian is going to enter the questions into the chat. So you can go into the chat to vote and to vote on what your answer would be, and then we'll review what the answer is and how everybody did. So our first question is focusing on the genetic or inherited skin cancers. So the question is, which family raises concern about an inherited skin cancer syndrome? I think that's how it's worded. Jillian, is that right?
Yep, that's right.
Okay. So these are very quickly, I'll just run through to give you a brief explanation. Both of these pictures are called pedigrees. That's a picture of a family tree. It gives us a visual representation of any patterns of cancer in the family that could be concerning for inherited cancer. We use squares for males, circles for females. Lines across show sibling relationships. Lines going up and down show parent relationships, parent-child relationships. And anybody who has been colored in has a specific type of cancer. You can see at the bottom in the legend what that type of cancer is. So, and the first family, we see our arrow is pointing to our patient. And I want to make sure you all know these are made up families. This is nobody who has participated in the impact program. These were completely made up. So the first participant or the first patient is 52-year-old male, no history of cancer. He does have a brother who had a basal cell carcinoma at 58. It was on his nose. And he noted that his brother does golf regularly, so he's outside in the sun a lot. If you go up a generation, you see that dad had a squamous cell cancer on his cheek in his 60s, but he's in his 80s and doing fine. On mom's side of the family, we can see that our mom had a brother with prostate cancer a couple years ago. Again, he's doing fine. And our patient's mother's mother had lung cancer in her 70s. So that's family one. Family two, we see the patient that we're speaking with is a 44-year-old woman who had melanoma once at 35 and then just recently again at 44. She has one brother who was found to have dysplastic nevi, which are those large, irregularly shaped moles. Their mother, unfortunately, passed away of pancreatic cancer at 65. She also was noted to have those moles like the brother. And then the mother's brother also had a melanoma in his 50s. He's in his 70s now and is doing fine. On the other side of the family, the only thing to note is our patient's father has a brother who had colon cancer at 72, but he's 75 now. So if you want to go into the chat and answer the question about which family you think could possibly have an inherited skin cancer syndrome.
All right, Julie, it looks like we have about 100 responses. We'll let people vote here a little bit more. All right, so it looks like about 67% of people said both families, and about 31% of people said family two. There's no votes for neither and no votes for family number one.
Okay, great. So it is family number two is the answer. So family number one, even though we're seeing two different people with skin cancers. These are the basal cell and squamous cell cancers, which are the more common cancers. They tend to not run in families. They were diagnosed at ages where we would typically see these types of cancers. Family number 2 raises concern for the FAM, or the familial atypical multiple mole melanoma syndrome, because we're seeing melanoma at younger ages. We see a person who's had 2 melanomas. We see pancreatic cancer in the same family as melanoma, and then we're also seeing dysplastic nevi. So, good job. We ready to move on to question 2?
Ready if you are.
Okay. So question 2 is, who is not at risk for developing skin cancer? I hope you all don't feel like you're taking the SATs again. So A is a person with darker skin tone. B, a person who has no history of sunburns. C, a person who always wears sunscreen at the pool. Or D, all of these people are at risk for skin cancer.
All right, looks like quite a few people have voted, and it looks like for the most part, everybody is saying all of these people are at an increased risk for skin cancer.
Awesome. Good job. That's what I was hoping for. Okay, let's move on to the last question.
All right.
Okay, if you are at average risk for skin cancer, meaning you don't have those risk factors that we had talked about, which of the following screening recommendations should you follow? A, no screening is needed. B, yearly screening by a dermatologist. Or C, monthly self skin exam. Sorry if you hear my dog barking. My kids are getting home from their last day of school and everybody's excited, including the dog.
All right, looks like we have quite a few responses coming in. About 84-ish percent of people believe that the monthly skin exam is the correct answer, C. And about 16% of people think that a yearly screening by a dermatologist. And there are no responses for no screening needed.
Oh, great. Good. I was hoping that would be the case. So, yes, if you are at average risk for skin cancer, there are no screening guidelines for skin cancer screening by a healthcare professional like there are for other types of cancers. So, if you are at average risk of skin cancer, we recommend the monthly self skin exam. So, C. If you do have any of the risk factors, then again, meeting once with a dermatologist for a baseline visit to get an opinion on how often they think that you should be followed. And I think we are done with the quizzes. Everybody did great. I'm going to move this over now to Kelly, our program director, to talk more about the impact program, and then we'll have time for questions at the end.
Great. Thank you, Julie. All right, so I'm going to talk a little bit about the impact program. And for those of you who have joined us for webinars in the past, this is all going to sound very familiar. So bear with me, and please, the idea is that you'll just remember this program whenever you or maybe someone that you work with might need us. The three of us, Julie, Jillian, and I, are navigators for the program. We are genetic counselors by training. And the idea is that we are here to help navigate individuals through a cancer diagnosis and ensure that anything that either Thermo Fisher has available as a benefit, or any resources that we've come across in the many years and many individuals that we've worked with, we're able to provide that kind of support. We are a program that is voluntary and free to use if you are on a Thermo Fisher health insurance medical plan. So that includes our national plan, which is United Healthcare, or the local plans like UPMC or Kaiser and some of the others. When enrolling, you would be connected with your navigator, and they would then become the single point of contact to answer any questions and provide that general guidance. I alluded to the services and resources that we have available. So, for example, that would be expert medical second opinions for a cancer diagnosis, in addition to genetic counseling and genetic testing, as I said, because we are genetic counselors. This is available in the United States only and in most states. I have seen a few questions in the chat around, how to know if you have a family history or are at risk for having a inherited condition based on the information that Julie presented, and that's what we're here for. So although we do work with many individuals who have a cancer diagnosis, we also meet with individuals that are concerned about their family history, and we can talk with you about what we might see in the family and if genetic testing would be appropriate, and then walk you through the process of having that done. And then we provide the genetic counseling on the back end. So once results are available, we would talk about what the recommendations are, what physicians you might need to see, and perhaps provide you with some referrals about who to be followed by. Okay, next slide, Jillian. As I mentioned, to qualify for the IMPACT program, you do not need to have a cancer diagnosis, but just have a concern related to cancer. And as I mentioned, be on one of those Thermo Fisher medical plans. And then lastly, if you are interested in enrolling in the IMPACT program, it's quite simple. What we ask is that you email us at impact@thermofisher.com. You only need to provide your name and an email address where we can then send an electronic enrollment form. You do not need to include the reason why you're interested in enrolling. You can if you would like to, but that's not necessary at that point in time. Once we receive that information, I will provide that electronic enrollment form in a separate email. Once that's submitted, then I would then send you an introduction email introducing you to your navigator and providing the next steps for scheduling a call with them. That would then just be the jumping off point for your relationship with that navigator, and you would both make a plan based on what you need. So as I said, please email impact@thermofisher if you have questions about the program or are interested in enrolling. And I say this every time we have a webinar. We are happy to work with any and all of you. We also get a lot of interest after these webinars, and I do my best to get through them as quickly as possible. If you do not hear from me in a day or two, please reach out again just in case something was missed. It doesn't happen very often, but I'm human. And so please, if you haven't heard anything in a couple of days, reach back out. But otherwise, I will be back in touch within a day or two, provide you with that enrollment form, and then get started from there. Okay, and I think that is everything. We have a few additional resources. You can check out the Colleague Service Center site, just search for IMPACT. And that is also where the recordings will be for this particular webinar, and also any of our past webinars that we've done will be located there as well if you missed them. We have 15 minutes for questions, and I know we have quite a few, so I'm going to turn it over to Jillian to moderate the questions, and Julie and I will both be available to answer either about skin cancer or about the IMPACT program itself.
Great. Well, thank you so much, both Julie and Kelly. I did just want to mention that we are recording today's presentation. It will be available on the Colleague Service Center IMPACT page, and you can find the link to that both in the chat as well as I answered a question in the Q&A. So you should be able to see it in both places. We're hoping to have it posted by early next week. All right, so into the questions. Julie, a great question came in. What if someone has a birthmark that is two-tone? So where that has two different colors associated with it?
That is a great question. I think it's really important to make sure that anything that you're concerned about, you have looked at by a physician, particularly a dermatologist. So birthmarks are different from moles, but it's important to have a doctor look at it and make sure it is a birthmark versus a mole. And again, if you see any changes within it, definitely something to make note of. But always, have it assessed by a physician.
Sorry, I didn't realize it was on mute. Also, another question that came up, if somebody has had melanoma once, what's the chance that they will develop a second melanoma?
That's a good question too. That really depends on your particular situation, what your own risk factors are. So that would be something that would have to be more of a, one-on-one discussion with your treating physician, or also if you have concerns about melanoma running in your family, meeting with somebody from the impact program to talk about your family history and whether or not there might be some high risk genetic factor. But it's hard to say just in general what the chances are of a second melanoma without knowing your particular risk factors. It was a good question, though.
And so if you're concerned that you have inherited gene mutation, what kind of testing would you ask for?
So again, through the impact program or through a private genetic counselor, you can be assessed for that to see whether or not there are any concerns about a gene mutation in your family. And then based on the information that we obtain from asking you family history questions, we can make recommendations about what type of testing would be involved. In general, it's called genetic testing, where we're looking at the DNA that's present in every single cell of your body that's passed down to you from your parents. It can generally be done through a blood test or through a saliva sample or a cheek swab, and typically takes about 2 to 3 weeks to get results back.
And then, thank you, Julie. Kelly, here's a question for you. This individual just wanted to confirm if you do not use the company's insurance, they're not eligible for the program.
So again, a really good question. That is correct. To officially enroll in the program, you do need to be on one of the company's medical insurance plans. However, if you have questions or concerns and would like to meet with one of us on a colleague-to-colleague basis, just to see if there are resources that we can provide, we certainly welcome that. So if that's your situation and you have a concern and are just looking for some basic support and resources, please email the impact@thermofisher.com and we'll handle it on a case-by-case basis and just see what kind of information, or we may be able to make referrals for you or get you to the right place to help out. So please still email us. We just wouldn't have you officially enroll, and there are certain services that wouldn't be available, like the genetic testing.
Thanks, Kelly. Julie, here's a question for you. Are people with non-Hodgkin's lymphoma in remission at any greater risk for skin cancer?
That is a great question. Unfortunately, I do not know the answer to that. My gut feeling is no, but that is definitely something I can research and look into and get back to you, but I don't know the answer to that. I don't know, Jillian or Kelly, if you do.
I know
No, I don't know the answer to that either. Yeah.
Yeah, I know generally in looking at lymphoma, or if anyone due to their treatments for lymphoma has needed any kind of a transplant, bone marrow, or even individuals that have had an organ transplant, I do know that taking a lot of the anti-rejection drugs from transplant can increase your risk of skin cancer. But outside of that, I don't know if there's any additional risk. Great question, but definitely we know who asked that question, and we'll try to swing back to you with another answer if we can find one. All right, another question that came up, Julie, what are some of the flags that you think about in a family, either for FAM or for indicating when you should see a genetics person to consider genetic testing? That's a question that had been asked in a couple different ways. So if you could just sort of more generally go through those, that'd be great.
Sure. Let me see if I can move the slides back. Probably not, because here we go. So in general, regardless of FAM or hereditary breast and ovarian cancer syndrome, in general, when we're talking about inherited cancer, which is about 5 to 10% of most cancers, the biggest red flags are when we see more than one person in the family with the same type of cancer, and if we're seeing people who develop these cancers at unexpected ages, so younger than we would expect. This is a rule of thumb for inherited breast cancers, colon cancers, pretty much all types of cancers. When we're talking about FAM, I'll just review these family history features again. It's specifically if we're seeing more than one person on the same side of the family with melanoma, people who have had more than one melanoma in their lifetime, again, melanoma at younger ages, people with these abnormal, large and irregularly shaped moles called dysplastic nevi, and if we're seeing pancreatic cancer in the same family. So all of these can be red flags for inherited melanoma, for this familial atypical mole melanoma. For the hereditary breast and ovarian cancer syndrome, where we do see a higher risk of melanoma, again, if we're seeing more than one person in the family with breast cancer, if we're seeing earlier onset breast cancer, ovarian cancer, pancreatic cancer, aggressive prostate cancer, all in the same family, these can be risk factors as well. But in general, as a rule of thumb, if you have concerns about your family history, the main red flags that we tend to see would be people on the same side of the family with the same types of cancers in more than one generation, cancers developing at young ages, and people who possibly have had more than one type of cancer in their lifetime. I don't know if hopefully that answers the question for you.
Yeah, I think so. There's a great question here about UPF rated clothing and how it provides protection, and is it treated with any specific chemicals or agents to get the UPF rating? So I thought I would just comment on this. The UPF is sort of a new thing, and if you're looking for UPF clothing, what UPF stands for is ultraviolet protection factor, and it indicates how much both UVB and UVA radiation a fabric allows to reach a skin. So for instance, if a fabric says that it's UPF 50, it blocks 98% of the sun's rays, and it reduces your exposure pretty significantly. What you want to look for is the Skin Cancer Foundation. It has a seal of recommendation for effective skin protection fabric. And you can often find, they have it on their website. They're a nonprofit organization. They're at skincancer.org. I'll put it into the chat. And they do UPF ratings. So UPF of 30 to 49 offers very good protection. UPF 50 plus is the highest it goes, and those rates are excellent. That UPF rating comes from a bunch of different factors they look at. So one of the things they look at is colors. We know that dark colored fabrics and bright fabrics have a tendency to absorb more of those UVAs and UVBs. And so it will bounce off some of those radiation, and that gives you some shield. Additionally, construction. So this is sort of a common sense piece, but if you have really dense cloth like denim or wool, you're more protective than a sheer cloth or a loosely woven cloth. And then also we know that the composition of the fabric matters. So unbleached cotton actually contains natural linens, and they act as UV absorbers. Shiny polyesters, lightweight satiny silks, they're all protective because they reflect the radiation in the same way that those fibers reflect all light to make them shine. You also sometimes can have high-tech fabrics that are treated with the chemical UV absorbers. So that is a possibility. There is a recommendation that no matter what you buy with the UPF seal, that it be loose. Any tight clothing can stretch, and that actually reduces the level of protection. So all of any UPF that you see on a fabric as part of a clothing line is intended to be worn loosely and not tightly. and of course coverage, the more coverage the more skin your outfit covers, the more coverage you have across the way. For those fabrics that have a UPF label, especially if they use certain fabrics or certain chemicals to treat for UPF, they have to be washed off in a certain way, or sometimes cannot be used in the dryer. So if you wash them inaccurately, then that can reduce the UPF protection. So it's just important that if you're using a UPF clothing, you kind of understand how to use it, as well as where to look for a label, and also how to wash it so that you're maintaining your UPF. The Skin Cancer Foundation does recommend that if this is a fabric you've been wearing for a while, that you consider wearing at least a base layer of skin protection underneath in terms of a sunscreen. All right. So, I should mention also SPF measures only UVB rays. UPF, so SPF is in what is in sunscreen. UPF measures both UVB and UVA rays. So it does have a broader UV spectrum protection. So I thought I would take that one on since it's something I actually just looked into recently. There was another great question here that I think it'll probably be the last one. I know there's a few other ones. Certainly we'll try to get back to you. So for people that have recurring skin cancer, either basal cells and squamous cells, how would they look for clinical trials or foundations that would help them investigate or get more information?
Another great question. I think the best route to go as far as looking for a clinical trial that might be helpful for you is to work with your treating physician to see if they have any suggestions. There is also a website. Is it clinicaltrials.gov, Jillian and Kelly?
Yeah.
Yeah, so clinicaltrials.gov is a website where you can look up specific clinical trials based on the type of cancer that you have and what your history is. So that would be another good place to look for clinical trials. Now, I should mention though, when we were talking about the inherited cancers, we talked mainly about inherited melanomas. There are very rare, particularly more with the basal cell, inherited conditions that cause multiple basal cells in a family. So if that's a concern, that is also something that you can talk to us about from a family history perspective. But much more rare to see inherited squamous cell or basal cells. But if there's a family or a person who's developing a lot of these types of cancers, that's something that we could address with you as well.
Okay. Well, thank you both very much. We're here at the last of our time for the day. As a reminder to everybody, today was recorded, and the recording will be posted hopefully early to mid next week on our CSC page, the Impact Cancer Care CSC site. And the link is in the chat to that site, so you can go check it out now or also bookmark it for later. We've also included links for UPF clothing as well as clinicaltrials.gov. If you have any questions, this is all of our emails, so you can reach out to us or at impact@thermofisher.com. Thank you, Julie, so much for walking us through this information today, and Kelly for telling us more about the program, and we really appreciate everyone attending. Have a very nice day and stay safe out there as you're enjoying your summer sun.
Thank you.